Updates on potential Wi-Fi health and safety issues. Hi, Cece. Cece, you want to come up here just like everybody else? Yeah. Be comfortable that way. We can do more of a conversation.
Well, thank you for having me back again for our third installation on Wi-Fi safety and public health. For those who haven't been here for prior meetings, Ashland Public Schools has become the first in the nation to put in place precautionary measures regarding wireless radiation emissions from Wi-Fi systems and devices in our schools. This issue applies across the board, not just in schools, but for all of us individually as well as in our public spaces. And I wanted to spend just a few minutes tonight giving you an update from what has happened since the last time we met. There is a study that just came out in an international journal that has applied the Hill criteria for causation with wireless radiation that's emitted by cell phones and by portable decked cordless phones. There's a 9-step process in order to establish causation, and the Hill criteria has been met, and I will give you each a copy of this before I leave tonight. The conclusion is that radio frequency radiation should be regarded as a human carcinogen causing gliomas. So the science is coming forward. In Ashland Public Schools, we had the opportunity with gratitude to our PTO and our administrators for bringing in a film called Screenagers. And Screenagers addresses the other piece to wellness around technology, and that is the digital addiction component. And we've kind of been on a Wi-Fi honeymoon for the last few years, and the industry would have us believe that all Wi-Fi all the time is the way to go. But the science is mounting that that is not the way to go. That children and adults in many cases are spending far too much time in front of screens, and with children it's impacting their developmental abilities. We have children showing up for schools in kindergarten, first, second grade all across the country, all across the world, who have not developed the proper human communication skill set. They quite often can't maintain eye contact. If there's a problem, they don't know how to self-soothe, and perhaps even worse, they have the inability to show empathy for others. So we are at one point in time, and with some education, we can all learn to use our technology more safely. This winter, some of our world's top scientists, doctors, and educators gathered for an international conference in the capital of Iceland called Reykjavik. And the result of that was the Reykjavik Appeal, which makes recommendations for schools regarding screen time and wireless radiation exposure. Basically, we should not be having Wi-Fi on in our schools at all around children. And hardwired solutions in countries where they have that infrastructure should be the choice, so that we can access the technology that supports a solid education curriculum, but without the exposure and without the excessive screen time. I will also leave you with a copy of the Reykjavik Appeal. On the local level, I have met with Doug Small at the request, at Doug Small's request. I've met with Roy Correa in our water department because I had seen an announcement in our local papers saying that we are in the midst of converting all of our manual water meters to digital devices, and I wanted to learn more about that. So Mr. Correa was gracious to give me a demonstration and showed that the part of the meter that counts how much water is being used is not active unless the water is flushing through the pipes. And I said, okay, but what does that mean as far as the radio frequency signal that's embedded in that meter? And so we took out my acoustimeter. You may remember we have an acoustimeter on loan in the Ashland Public Library that any resident can borrow for 1 week. And we discovered that even when the system was not active, the microwave radiation pulsing continued throughout the day. So we need to be very careful with putting these devices on our homes. The water meters, the gas meters, the solar meters, the solar inverters, and the electrical meters all emit this man-made electromagnetic radiation that is in far, far excess of what our natural state is with that. So I understand there are issues because the industry, once again, is pushing digital technology and wireless technology, but we, as health agents, need to become educated so that we can ask those manufacturers to please come up with technology that is good, but that's also biologically safe. Right now, we are also being faced with 5G and the Internet of Things. 5G means 5th generation technology. And right now, most of our wireless devices operate off of 3G and 4G technology, and those are the antennas that we have on our water tanks, on cell towers, on some buildings. And with 5G, the hope for the industry is that they will be able to deliver much more data much more quickly. But with 5G, those vast quantities of data will not be able to travel very far. So the industry, if they have their way, would put what they're calling small cell antennas inside our neighborhoods every 4 to 12 houses, and that will be biologically very unsafe for our population. It doesn't mean that they're taking down 3G and 4G, because 5G will not go through buildings as efficiently as 3 and 4G do, so they will keep the existing infrastructure, add to it, and further blanket our neighborhoods in electro-smog. I had a talk with Sheila Page, who's our new wonderful town planner, and asked her what we have in our bylaws that would give us the opportunity to examine these applications from the industry to make sure that they can't just come into our town and put this infrastructure up without our informed consent. And she took a look through our bylaws, and right now what we have is a process that requires a special permit to add to or to change existing infrastructure with wireless communication facilities. So that's terrific. And Roy Correa had mentioned, I had told him that when you drive out of Higley Road and you're heading into Framingham, if you look up, you will see these like transformer stations up on the poles in Framingham. It looks like a box that has these units hanging down off of it. Those are transfer stations so that the data is aggregated and carried off and used. And he said, fortunately in Ashland, we can't afford that technology, nor do we want it in our town right now. So I hope that we will keep that mindset. Just because the industry is pushing this, we need to step back and say, is it healthy for our residents? Safety first, I hope, will always be at the forefront of what we do. Ms. Page introduced me to Michael Crucifulli, who's our building commissioner, and he and I had a good conversation to see. Right now, Ashland has a 300-foot setback from schools and residences for any kind of wireless communication facility. Randolph has a 500-foot setback, and he was going to check with other peers in his organizational structure to see what's the maximum that some people have, because all of this goes through the Attorney General's office before any bylaw is approved. So if there are already precedents out there that would give us better protections in our own town, it would behoove us to understand what those are. Mr. Crucifulli also mentioned that there's going to be a regional meeting of building commissioners that's coming up in May, and he put me in touch with the president of that organization, and they've invited me to come in and begin educating all of the building commissioners there, because every town should be looking at their bylaws. The town of Weston was not as well positioned as Ashland is. The industry came in and pulled permits for 3 of these small cell distributed antenna systems that would literally put a cell tower on people's property lines in the public access way there, on a pole at street level right by where our bedrooms are. And unfortunately, the FCC has this shot clock rule that says you have to respond to these applications within X number of days, and that window is not wide enough for a town to put in a bylaw that would then protect the citizens. So it's important for towns to begin looking at this, because the industry has already fast-tracked 2 bills at the federal level. Senate 19 is the Mobile Now Act, and Senate 88 is the Internet of Things Act, the Digit Act. If those pass, they are aiming to take away local authority to say if or where we want cell towers placed. So we need to become educated, and I know, Mr. Roram, you shared with me that back in the 90s,
They did that with the cell tower placement as well and took away local home rule. And they're pushing really hard and fast to do that again with this infrastructure for 5G technology. Out in Ohio, they slipped a bill in with some sort of a dog licensing bill at the end of last session, and they slipped in to take away home rule on cell tower placements. Cincinnati and over 80 other towns in Ohio are now suing the state of Ohio, working with their Attorney General office. So we just need to come up to speed on this and see what's coming down the pike, because we know now that this is a biological hazard, but the industry is pushing as fast as they can to get local rights taken away before the public fully catches on that this is a biological hazard. Michael Hugo is the Framingham Board of Health director, and he has been in touch recently to say that they are indeed keeping this on their radar. They're dealing with a chemical company issue in their town right now that's using all of their resources. They also have a new school superintendent, so once they get through those milestones, they will return to this issue and resume the EMF discussion. Commonwealth Conversations, I know some of you were able to attend the Commonwealth Conversation that Senator Spilka hosted out at the Warren Conference Center, and that was a town hall forum to give residents the opportunity to speak directly to our senators and voice their concerns. I was able to go and give a 2-minute testimony on 5 bills that we now have in the Massachusetts Massachusetts legislature. Senator Karen Spilka has introduced a bill to get the right bright minds at the table at the state level to begin addressing this issue. And Senator Michael Moore out in Worcester has introduced a bill to give people the right to opt out of any kind of a digital device being imposed upon their residence or business. So any of those smart utility meters, if you don't want one on your home, you should not be able to be forced to take one without informed consent. And if you choose to request an analog meter that does not emit any microwave radiation, you should not be fined for it or be surcharged for it. So that's the second bill. And then 3 other bills showed up this session. One of them is from Representative Carolyn Dykema, who's a neighbor of ours here representing Southborough and Holliston and some of the other towns. She has put forth a bill that would ask the Department of Elementary and Secondary Education to put best practice guidelines in place around wireless technology so that we do not expose our students and staff to microwave radiation. The final 2 bills were put forth by Senator Julian Cyr of the Cape and the Islands, and he is asking for right-to-know legislation so that for every device that you buy that uses microwave radiation, it has a disclaimer on it saying that this is biologically active, and provide what the fine print is that the manufacturers themselves provide, buried very deeply inside user manuals or very deeply inside the devices themselves. Basically, they say, if you keep this device on your body, you will exceed the FCC guidelines. Now, those guidelines, as we've discovered, are over 20 years old. They do not account for any biological harm. They do not account for today's science. And basically, by touching a device in active mode with your body, you are exceeding those FCC guidelines, and the public simply does not know. So it was a privilege to be able to explain this to our senators. The Senate president was there, and a great deal of the leadership team was also there. I joined them for a similar conversation out in Peabody last week, and the final Commonwealth Conversation will be held out in Worcester next week. And I know there are other residents in that community who are very concerned because National Grid is rolling out that utility smart meter pilot there, which is hitting some financial snags, and they're going back to ask the ratepayers to pay $15 million more for that pilot. So the Attorney General's office is also investigating that one. And one of the documents that I gave to our senators during these community conversations is something that I've created called EMF, or electromagnetic field, points of confusion versus fact. As I've gone down this journey myself, I've had a lot of questions. Why didn't we know about this? Why isn't the FCC protecting us? All sorts of things. And anybody who joins this conversation starts having those same questions. And I have found the answers to those questions. So I created a very simple fact sheet that I will leave you with here. And I'll leave you my business card, which on the back has my research repository on it, and you can get any of these documents in electronic format as well. So for next steps, I would ask that we continue to be in touch with Dr. Bob Knorr at the Department of Public Health. He is in charge of the Bureau of Environmental Health, and he is working on public health fact sheets to start educating the public on the need to take precautions around wireless technology. The last time we spoke, they had been going through internal review with the DPH, and his superiors had advised him to put them in with the graphic design staff. So that tells me that they're getting close to releasing for the public, which means that we, on the municipal level, should begin thinking very seriously about how we're going to protect our employees in public spaces. Are we going to begin investigating what it would take to use hardwired technology, train our staff so that we're not always using perhaps a company-issued cell phone or device on our body, but to learn the simple ways that we can use today's technology but without the risks that we are currently enduring today. And then I also wanted to ask if there is an annual conference for folks like yourself where we can begin educating on a broader basis within Massachusetts.
I don't know the answer to that, do you?
I would refer her to Marsha Beness, Massachusetts Association of Health Boards. Cece, just drop me an email and I'll send you her contact. But she's at Mass Association of Health Boards, and she may be a stepping stone for you. You might find her on the web just from a web search.
All right.
But as always, a great presentation, Cece. Questions from the board? Please.
Just one comment. Mike Hugo is actually the Board of Health Chairman. The director for the Health Department of Framingham is Michael Blanchard.
My apologies. He is the health agent in Framingham.
Any other?
So I have
That was really helpful.
Okay,
Thank you.
Thank you for presenting. I had a couple of questions. You talked about the water meters here. Are they emitting quite harmful
They are.
amount?
Actually, it was kind of funny. They literally had one of our recycling bins full of the units ready to be deployed, and I set the acoustimeter down in there, and it just sat there flying right off the charts, and it wasn't even hooked up yet. So those microwave radiation emitting devices are in active mode all the time. And so in your home, you would want to be sure that nobody's sleeping or spending significant time anywhere around those, because the signals go through the floors, through the walls, through the ceilings, and you don't want to be sitting there in that field of radiation.
And you also talked about looking at maximum distance to implement in the bylaw. What happens to the existing ones?
To the existing
Ones, which have been placed now with 300 feet. If your bylaw comes up and says 600 feet, the existing stays there. That's still there. And then
Yeah, I've asked Mr. Crisafulli if he could also look to see when are our current licenses expiring. So it would behoove us to understand what we have right now and what our rights are as a municipality to push back on the industry a little bit and say, we do not want this technology so close to our loved ones.
I am not familiar with the permitting process that goes through for each of these things. I'm not sure if you know it or not, or Mark, maybe. Does it come to the Board of Health for any permitting process, or are they not required to come to the Board of Health?
It would go through the planning board if it's a special permit.
Right.
Also, at this point, any radiation goes through the Department of Public Health. They handle it all, or the federal government.
So we don't have any say at all.
Not that I know of. That says,
Although I would hope, so if Randolph has a 500-foot setback, maybe we could look
That's
at having
planning,
something
yeah.
along those lines. You know, whatever we can do, and I don't have all the answers, and every town is gonna have to address this individually. But if we can just get the right people thinking about it and asking the right questions from where they stand as experts, then I think we'll come up with the best solutions we
So you
can.
know?
Even that, we were not doing it, are we? Even the distance, are we able to do that, or it has to go to some other?
We're not, because I'm gonna make my point, but if you're done,
I'm done,
we'll
yeah.
go to Mary, yeah.
I just have a question as to what has been done as far as public education for the parents that are out there. I mean, we know what's going on in the schools, but are the parents aware of what needs to be done at home, and has anything been done, and is that something that could be done with the local TV station?
Absolutely. When I first raised this issue with the schools, it was news to everybody. Our IT director wasn't aware, our town administrators weren't aware, our school administrators, and that's credit to the industry. They've been incredibly effective at suppressing evidence of harm and creating doubt anytime a credible study is published. It's basically the tobacco industry playbook. And so our school committee came up with a set of best practices that say turn off the Wi-Fi when we're not using it, turn off the devices and never keep them on your body. But we are the first in the nation to have taken those basic steps. And so when I asked our superintendent if we could educate the parents on it, he had just literally become our superintendent, and it was his first time in that role. So, you know, he kind of held up his hands and said, that's the best that we can do right now. And I said, okay. So I had spoken to Mr. Orem, and I knew that we didn't have any additional information in our town around it, so I went to Senator Karen Spilka, and I measured her cell phone and her district director, Pooja Mehta's laptop, and both of them went off the charts with where biological harm is for microwave radiation. So that's where Senator Spilka put me in touch with a lawyer in her office so that we could create a bill to begin educating the public. And I've also been working with the Department of Public Health to, with some of the top scientists on this subject and some of the professors in our institutions to get the credible information in front of people. And that's what we're hoping is when those fact sheets come out, they can be distributed through our towns, through our schools, through our health boards to begin educating the public and get to the parents that way.
My only fear is that we have this, it's going to go through the judicial system with Senator Spilka, but the residents are not going to know that she's doing it for their benefit, because the education is going to come after the bill is passed.
Right, that's an excellent question. So on this journey, we had a panel of world experts come present to the Massachusetts legislature in 2015, and that's where this Dr. Deborah Davis, who's a Nobel Peace Prize co-laureate, she's one of our nation's top scientists, pulled me aside and said, congratulations, you are the first in the nation to even have a sign laminated and hanging in each one of our classrooms. And I was a little incredulous because I was just doing my due diligence. I helped bring that technology into the schools as the former president of our education foundation, and then I worked for the schools for 5 years as our grant coordinator. So I helped bring in all this technology, so I dove in and got to the bottom of it and found out, yes, it is biologically hazardous. So I'm a technical and professional writer by trade, and I wound up doing some grant writing with this Dr. Davis, and at that time, a gentleman in the UK was realizing that there's a big gap with education. And so I volunteered my tech writing skill set with this UK nonprofit, and we have come up with 40-minute online courses that take the international science and the international medical best practices around wireless radiation. And for literally less than the cost of a movie ticket, anybody can go to wirelesseducation.org and get this issue top to bottom, along with a fact sheet that kicks out at the end that tells you what to do with your cell phone, what to do with your home sleeping areas, and all the little things we could do today to protect our citizens. We built in a Robin Hood model so that if companies want to license the course, which is again extremely reasonably priced because we're a nonprofit, for every corporate license, we will donate a school license so we can start educating our schools. So if there are companies that you work for, or hospitals or doctor's offices that might like to participate in that, then we can start getting the whole public educated. So we're trying, we're doing the best that we can to get information.
I got one more, and then I have a question, and then unfortunately we're going to have to move on, but
Sure.
nice job.
The question is if that's processed in the school to avoid or minimize, does it also have to be done to the government department like the building here so that it also doesn't affect the employees' health?
Exactly.
That's,
I would.
that's very
if
important.
it were up to me, I would definitely hardwire every internet access point that we have and turn off the Wi-Fi. If you are out and about and you absolutely have to use your mobile device, then put it in active mode for the moments that you need to send and receive data, but put it back in airplane mode for all the rest of the time, and that kills the microwave radiation signal.
Right.
So we should be thinking about this. My whole home is hardwired. We don't have Wi-Fi in my house, and we have all the technology we need.
The other things, when you get a chance next time, if you have a high tension electrical wire which carries the AC current, it does also produce
It
radio
does.
frequencies, more
It
or
does,
less.
and in fact,
And
the
if-
Department of Public Health is doing a series of EMF fact sheets,
Mm.
and that's one of them.
Okay, thank you.
Cece, I just have a couple questions. As you know, my oldest son is autistic, and a lot of the symptoms that you described here tonight are like that. And I've had pediatricians tell me that possibly, the key word is always possibly, no causal effect, but possibly autism spikes have been caused by Wi-Fi technology. But I also hear, both sides of my brain also hear, this is the world's biggest cover-up. Because I work for General Motors. Every General Motors car you have has Wi-Fi in it now. My washing machine, my dishwasher, my refrigerator at home, they all have Wi-Fi in them. So, and I'm not here tonight to say that you're right, and I'm not here to say the government's right tonight. I don't know, and it's very concerning to me, but nobody around the world has said this has to stop. I mean, maybe you're the first, and maybe you should be congratulated and commended for it,
No,
but
around
nobody.
the world.
So why isn't anybody?
Why isn't anybody? Because
saying, okay,
the
this is
industry
fine.
has been extremely effective at suppressing evidence of harm and creating doubt when good science is introduced. And you don't get it through mainstream media, because if you listen to your radio or your TV, what advertisements are you hearing? You're hearing telecom industry advertisements. So our mainstream media will not cover this issue because they cannot afford to bite the hand that feeds them. So the public continues to consume these products. We have to educate ourselves. And with
But is
the-
it fair to say that it doesn't affect everybody?
I have heard from scientists who say whether you feel the headaches, whether you feel the insomnia, whether you feel the ringing in the ears, the nausea, your cells feel it. We don't feel cancer coming on. We don't
Right,
feel
right.
infertility coming on. But our cells biologically are blanketed in this today.
And I guess what my long-winded point, and once again, thanks for coming, you have a great presentation. And thank you for Senator Spilka for stepping up, but it's probably not enough.
You're right, it's a start.
Where's Elizabeth Warren on this? Where's Ed Markey on this? Where's
Actually-
Donald Trump on this?
Actually, Ed Markey's office and Elizabeth Warren's office, we have been in touch with. This Dr. Deborah Davis that I mentioned, she and I were in touch with Senator Markey's office. He actually was behind the impetus that got the National Toxicology Program done. That study has been done for years, but there were congressional hearings on this back, a decade ago. And corporate influences are very powerful. So other countries have addressed this. France now bans any kind of Wi-Fi in preschools or kindergartens, and they have limits set for turning things off around the older children. So
Cool.
Russia's, we allow 580 microwatts per centimeter squared of microwave radiation per gram of tissue at the cell phone frequency, 580. Russia allows 10. So Russia's done the research. They run fiber optic cables out to their residents. They've turned their back on 5G because they know this is biologically hazardous. So we as a nation need to get educated at the grassroots level, at the municipal level, educate our higher authorities, and somewhere meet in the middle and start figuring this out.
Well, thanks for doing all the heavy lifting.
You're welcome.
And can
Well,
we
yeah.
get those? Yeah, that's
Come on.
great. Thank you.
I'll leave you this one. Nice doing mine.
Dr. Deborah Davis, her PhD is in sociology,
No.
Thank
Dr.
you.
Deborah
because I just
Davis
looked
is
it up.
She's an epidemiologist. She also has a master's of public health. Deborah with a V, D-E-B-R-A.
Right, her PhD is in sociology, and her,
We're gonna have to
That may be, but she
keep
may
this
have
on the
another.
internet,
Yep.
so
Gonna have to go.
But she is a public health.
if you get a clean one, I'll give you the red one.
Thank you. Thank you very much.
So feel free to reach out with
Yourself
any
the record.
questions. Again, my research repository is on the back of my business card. And there's a wealth of information to begin your own research. If there's anything I can help you with, please just let me know.
Thank you.
All right, thank you
Cece.
so
Nice job
much.
as always.